one of the great pleasures I've had, not only chairing the dialogue, but chair currently of the Campbelltown Health and Education Precinct, and recently the chair of the South West Sydney Local Health Advisory Board. So it's chairs. Me not included. I'm trying to think of the collective noun for chairs. I think it's an eminence. It certainly is today. And none of them argued when I suggested that before, so we'll go with that. But a pleasure to have the three chairs of the LHDs up here. Can I firstly pay tribute to all of you? The fact we're here, and as speaking to Ryan Park about outside, said there's nowhere else in New South Wales do you see LHDs working together like in Western Sydney, and that was not always the case. So to those who've gone before you, as chairs, as CEOs who worked really hard, and the commitment you're all making now to keep that collective spirit going, we have an entire region to keep healthy, to make healthy, and I think everybody in this room and the communities you serve can be very grateful for the leadership you're all showing to that end. I wanted to have a quick chat to the chairs. We'll make a quick lunch is following, with a special presentation before we get outside as well. So just in talking to the chairs beforehand, I suppose what I spoke about, we've got a very technical presentation through the day, a lot of detailed tactical issues, and maybe we talk strategically, sitting atop their boards, atop their regions, and those challenges that are facing. So I broke it down in some areas of things like amenity, opportunity, productivity, and inclusivity, that they can sit in the chair's seat and look across the entire region. So let me start with, and welcome them all, but not level of length of service, but Loretta from the Great Western Sydney Local Health District, great Peter Collins, and Sonja, known as, very known now as J, Sonja Stewart, because two Sonjas and one LHD at the top is confusing for everybody. So from now on, she's the J, she's Sonja with a J. Let me kick off, Loretta, with you at the end. This concept of responsibility for LHDs, more than just public health, more than just managing hospitals, but we look upon you as a region as the place where smart jobs for our kids in the future will be, the place of increasing amenity, a region, unlike this beautiful new building, that has not always been dotted with great public buildings. How that, when constrained budgets, can a public hospital bring cultural amenity to it as well, and also the role for the LHDs in that community inclusivity piece. Does your board get that? Are you budgeted to be able to look in a strategic sense in an ongoing way?
Small question to start with, so thank you for that. Yes, the long-term vision around our communities is fairly central to all things that we do, and inevitably there's some short-term, operational and other matters that we have to address. But I'd say that the embedded ethos in the organisation is all about access, it's about equity, and it's about how we're going to deliver services into the future. So while there is a lot of activity that you see on the short term, the planning goes on in the long term. And it happens in a few ways. So there's some very big structural, very optical things you can see with the developments of the precinct and the large infrastructure. But there's also the work that goes on in the long-term preventative health, and also the work that goes on in certainly our work across all our communities. And some of the work that we're working on now that will have an impact into the future goes on sometimes despite the fact it's not necessarily aligned with the way things are funded. So I can point to a couple of examples. One is around health literacy, and we've heard that referred to a couple of times today. We saw the importance of it through COVID and understanding how we could reach populations that we needed to. And increasingly we're seeing that if you want to navigate your way around the health system, you need to be armed with all of the tools that you can be. And of course the stats in Western Sydney will tell us that close to 50% are born overseas. It's more than half speaking a language other than English at home, and the increasing number of communities just mean that work is critical. And the work that we do is leading and is starting to be rolled across the state. I saw people like Alpha that from Syd West Multicultural Services and other ways that we channel into partnerships to make sure those messages get out. And they're long-term messages, and they're long-term preventative things that happen. Things like workforce are also really critical to us. So we have a population that is increasingly got high levels of education. It's young, it's multicultural and multi-talented. We have so much diversity, and it's in our DNA to work in diverse groups. We've got that, and then we've got health systems that offer all the opportunities. I can't think of anything in health that you can't do in our district. And so when we marry those two up, that works in theory, but we've got to keep supporting the workforce once we've got them on board, and to your point about the consistent development. So a lot of work is now going into not only the training and education. I think I read a stat internally that we've invested something like 1.5 million hours of training and education in our district. But it's leadership development, it's making sure our workforce is agile, it's the interactions between the medical, nursing, allied health and other staff. All of that combined will set us up for the future in how they'll be able to manage the work of the future, the health models of the future, and then we supplement it with tech and other things as we're starting to see new developments.
Cool. Peter, if I added one more to that list, it would be advocacy. With a distinguished career in politics and business, you've got a little more freedom, both a longer serving chair and a chair, not a CEO. How do you balance the need of being representing as a government appointee to this board and the sometimes commitment and requirement to speak out, to step outside your lane and be an advocate for the region as well? You manage it pretty well, so how do you do it?
Well, in answering that question, I realised that my job could be on the line, but I think that after the career that I've had, starting as a shadow minister, I mean, I've been in health 40-something years. I've been health minister for 3 years, and I've been involved in health ever since I left politics. I am prepared to advocate for certain causes. I mean, one of them, if we're talking Western Sydney, I'll put this out there. I think that the epicentre of Sydney is, as we've known for a long time now, Parramatta. And back in my day as health minister, that's why I moved the Children's Hospital to Westmead, which wasn't, I mean, it sounds like, yes, that's easy. It wasn't, because you had universities, deans standing off, you had entrenched interests in Camperdown. We moved the hospital to Westmead.
You had surgeons living in Mossman.
So I'll put this out there, Chris. I think that the Ministry of Health should be relocated to Parramatta from St Leonard's. And I say that for the reason that it's all about where you are that forms your perspective. And the perspective and St Leonard's was in my electorate when I was in Parliament. The perspective you have from a beautiful, leafy, compact, well-serviced electorate like the one I represented in Willoughby is very different to what you get the further you come west, where you have less infrastructure, fewer services. So I think that, I'll put it out there, I think that the ministry should be relocated to Parramatta because it gives a very different perspective, and I think that it would affect the funding flow to the west.
Demonstrable change in culture, education and planning since they've relocated to the west. So where's that, Adam? You here somewhere? Put that on the list. We've just taken that on as our next challenge. We've got a hospital move to Bankstown Town Centre. We need another health challenge, so we'll take that one on. And we'll get the feds to bring SBS to multicultural Western Sydney, add a monocultural Artarmon while we're at it. Sonja, so Sonja Stewart, Jay, the newest chair. I flip it for you because you've been in the job a very short period of time. So tell me about when you're asked to become chair, you take on the role, you've arrived. In your short period already, is the working of the LHD what you thought it would be? Is it early impressions of the role you can have as chair and the LHD can have going forward?
Yeah, thank you very much for your question. And I just wanted to make two quick acknowledgements. I'm a Yuin woman, so it's important for me to acknowledge we're on Aboriginal land, and it always was and it always will be, and also acknowledge my predecessor, Sam Haddad, who is just an amazing individual and did a wonderful handover, and I knew you in government, and it was just thank you very much for everything you've done. So in terms of coming, I'm new but I'm not new, and I think that's important to say. I've served on the Health District Board, but for me coming in, I think there's three things that really strike me in the conversations that the board's having and in key interactions with the executive leadership team. And the three things are around purpose, they're around impact, and they're around opportunity. And I think that's really important, and very clear about health and wellbeing of a very important region, a very strengths-based approach to the community, but also a notion that this is the third largest economy in all of Australia, in this greater Western Sydney. I think the thing around impact is understanding that we are a very, very big workforce. We have a very big physical footprint. We are part of a very big and important industry or service system, and also acknowledge the PHNs and universities and institutes and research and development. And I think the one around opportunity, and that was led by Sam and the board, around community engagement and partnerships. So being very clear, what do we do? And we're very clear about what we need to do in terms of service level agreements and health services plan. But who is also really good at this, and who do we partner with to achieve those objectives? So they're the three things that have struck me very early on in the couple of weeks that I've been in the role. And getting used to Sonja with an I, Sonja with a J.
As you can see, they've got us on a very tight leash because they reckon there'll be a riot if we don't get this mob fed soon. So I'll give one quick question to each of you. We'll get a quick answer and come back. It'll be, Loretta, for you, the single best thing your region can do about smart jobs for entire Western Sydney.
I think it's going to be leveraging both the precinct, which is very significant and a generational change, but along with leveraging the whole opportunities across the district. So, you know, we obviously have a new hospital, but it is really about how we're able to say across the whole of the district, how do we best coordinate the services, use the specialist services. We need to find the ways that we get the right delivery and the right care across that. And the smart jobs will come because at the epicentre of that is a precinct that is really in a wonderful position to have the adult and children's hospital, to have the research institutes, to have the leaders in sort of oral health, and a whole array of partners that will centre it well, and then feeding from that will be the associated businesses, the cultural, university, education, housing elements that sit around it. So that is going to be the epicentre of what is a well-coordinated district.
Peter, the one thing that you like to see this partnership evolve, what can the three LHDs work on really well collectively, and not just individually on behalf of the region?
I think that we three LHDs need to do exactly what we're doing today, and we need to work out a common agenda, because one of the things that one of my observations about public administration is so much of the money is tied up, and you can have changes of ministers and changes of government, but it's almost as if the ministers only get some play money to play with. The serious money is so tied up that it's virtually impossible to change. Departmental allocations, they're set in train for years ahead. So I think one of the things that we can do is develop an agenda where we can try to pick off things that we can bring out here. I'll give you an example. If you take the LHDs east of Parramatta, of course, as buildings wear out, as staff need to be replaced, they should be replaced one for one. But that's not where the growth should be. The growth should be out here. And I think if we can work out, if we can target services that we would like to bring to Western Sydney, things that we can achieve excellence in and be regarded as the state centre for particular clinical services, then I think that's something that government should have its attention drawn to. And over time, each of our teaching hospitals in particular should accumulate specialist roles that actually provide services statewide.
Jay, In a multicultural precinct, diverse region, you're the most diverse within South West Sydney. What's the most important thing an LHD can do to add to the social fabric of the regions we serve?
So I think this is something that we have definitely spoken of and acknowledged Sam's leadership in this. I think there's, three things that we can do. One of them is to really think very deeply about the tailoring of our offering and the listening in that, and there's examples of our innovation and our research strategy, and capture those deep lessons through that global pandemic. I think the second thing is really partnering, and there's some great examples in the district around key messaging around Assyrian radio and in language about the importance of heat from the panel before, or vaccinations, and looking at who are some really good organisations and leaders in the community who can get that message out. And I think the third thing when you're doing that listening and you're trying to customise is to be really aware in that social fabric of the things that you could do better. Yeah. And one of them is around trust, and I know from an Aboriginal perspective that there's sometimes very deep distrust in terms of systems and big institutions. And the other thing is around digital, and if we're going on a digital platform or a digital approach, what are people's literacies and things like that. So I think they're the sort of approaches in terms of our community engagement and learnings and listening, and getting that right and really contributing to the broader fabric, and which is such a great asset for that district.
Well, despite having a couple of roles recently in sharing some health areas, my experience of health has largely been as a patient, as a parent, as a carer. My mother started at Parramatta Hospital in the late 50s as a nurse. My long-term girlfriend lived at Westmead. I spend way too much time at the Westmead Nurses' Home.
It hasn't changed a lot since, but we're working on it.
The building's still there. And not only is there not a plaque on that building, there's no plaque at St Margaret's when they knocked it down when I was born as well, when we didn't have appropriate maternity hospitals in the West. So, but on behalf of all of those communities you serve, those patients and those staff you lead, thank you very much for your service to all of you.